Good evening and welcome back to Sports Center. I'm Haley Pels and tonight we're talking about squats. So as you probably know, a squat is a strength training exercise that is widely used for things like rehabilitation and fitness training programs. So today I've got 4 biomechanics experts to give us some important information about how to perform this exercise successfully, how to get the most out of it, and even how to prevent some injuries. So please welcome Kimber Glenn, Katie Kennedy, Jairo Mendoza, and Catherine Webb.
Thanks for having us. A recent sports article by Ronald Tindler investigated velocity and muscle activation during a squat performance. The study looked at healthy trained males performing 2-legged full squats with slow, normal, and fast descent phases. Kinematics and muscle activity of 10 muscles divided into 5 regions were measured. It can be concluded that slow descent velocity had a negative effect upon the ascent phase, because of a lower velocity and peak force increasing the chance of failure. Slow descent velocity causes lower peak force and longer sticking and post-sticking regions. It thereby increases the chance of failure, since the sticking region is the weakest region of the lift. Based on present findings, it is advised to athletes and coaches that the descent movement in back squats needs to be as high as possible without losing control. This helps in the ascending part to overcome the sticking region quicker and thus decreases the chance of failure of the lift.
Good point, Kimber. And on that note, standing and foot angle placement affect the way an individual squats, and manipulating those variables can allow an individual to choose which angle they want to focus on. For example, in a recent study titled How to Squat Affects the Various Stance Widths, Foot Placement Angles, and Level of Experience on Knee, Hip, and Trunk Motion and Loading, it was found that extremely narrow and extremely wide foot stances and toe angle placements of about 42 and 0 degrees had the largest changes in knee displacement. So one should take caution if they're going to squat using those positions. Evidence-based guidelines for the execution of a squat include feet at about shoulder width apart and toes facing forward or slightly outward to avoid the medial and lateral displacement of the knee. The study examined 3 different stance widths, narrow, hip width apart, and wide, and then also 3 different toe angles of 0 degrees, 21 degrees, and 42 degrees. The results of the study suggested that the recommended squat stance should be hip width apart with toes completely forward at 0 degrees, or a wide stance, which is twice the distance between the 2 anterior superior iliac spines with toes pointed 21 degrees outward. This will prevent possible injuries that can come with medial and lateral knee displacement during a squat.
Katie, let me add on to it. So in a recent article by Ollie, it is extremely important to maintain a center of mass. If you don't have a good center of mass during a squat, you could lean forward, which would result in injury probably. Also, this will result in a velocity and acceleration change if it was being recorded. The change would be drastic, very sharp since you fell forward, which is not what you want. So, with this being said, having a stable center of mass allows you to control your movement going upward and downward as well. This will have you control your movements while having an acceptable, not change, but recording of acceleration and velocity, which will reduce your risk of injury.
Preventing injury is so important, and squats are actually a great exercise to prevent injury in the future as long as you do them correctly now. They can reduce your risk of osteoporosis and bone loss by placing resistance on your hips and forcing them to get stronger. One study by Gabriel Haberle found that squatting deeply with some added weight, like a weighted jacket, is the most effective method to strengthen your hip joints. The load that is placed on your hips during a squat is also affected by the angle of your trunk, so it is important to make sure it is flexed and that you are slightly bent forward at your hips, and that your core muscles are engaged. The risk of injury is a lot higher when you don't squat properly though, so it's very important that you use correct form like I listed above and like my colleagues have listed as well, because injuries while you are young can lead to injuries when you get older too, such as hip fractures. So it's important to work hard but not go past your body's limits so that you prevent injuries now and in your future. Thanks for having us on your show, Haley. If you're interested in learning more about the biomechanics of what we talked about today, here's a list of all the articles that we referenced in our broadcast. Now on to your commercials.